Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
This is Dr. Lavanya Govada, ENT specialist. We are going to talk about a topic on balance today. Imbalance, in medical terms, is called vertigo. So, what is the relation of an ENT specialist with vertigo? You may think balance and an ENT, how are they related? So basically, the ear consists of three parts: external ear, middle ear, and inner ear. So here comes the balance. Inner ear is associated not only with hearing but also it has some balancing organs. So inner ear in medical terms we call as labyrinth. It has two main parts again. One is cochlea and the other is vestibule. So cochlea, which has a clear nerve in it, is concerned with hearing. And today we are not dealing with hearing part, we are talking about balance. So this mainly is organized by vestibule. So again a part of inner ear. And this vestibule again has two parts in it. Mainly the vestibular system is the balancing system inside the inner ear, which has two main portions related to the balance. So one is otolith organs. These are again two: utricle and saccule, some membranous structures which are again dealing with a linear movement. I mean here linear movement is our head moving in one direction, like moving it up and down like nodding or bending forward or turning your head to sideways. All these come under linear movement, and this linear movement is dealt with utricle and saccule. So how does they help in balance? So these organs, they have something called otoliths inside them, which are a kind of calcium crystals. So whenever we move our head, the hair cells inside move, and they sometimes what happens, these crystals they get displaced from their original position, giving us a misorientation of head in the space, which gives you a feeling of dizziness or giddiness. Okay, and the second thing is semicircular canals. There are about three semicircular canals. These are nothing but a simple U-shaped bony canals inside which they are filled with some fluid called endolymph. And again, they have some sensory hair cells inside them which help for detecting the position of the head in the air. So, how does they do this? Again, these three semicircular canals are not in one plane. So they are oriented in three different directions. For you to understand, like one is in x-axis, y-axis and z-axis. So one is oriented superiorly, posteriorly and laterally. So this helps our brain to detect in which position you are in. Like these semicircular canals, they help to maintain an angular acceleration. Why is it in three different planes? So sometimes when we go to some recreational activities, like when you go to some places called Wonderland and all, you see lot of things which move your head in different directions, like kind of when you get into a giant wheel or a merry-go-round, which moves in different angles like front and back. So these positions, whenever you are moving in different kind of directions in three different planes, the fluid also inside the semicircular canals, it moves, and this makes the sensory hair cells bending in one or other direction, and this sends signals to the brain and how fast you are moving and in which direction you are moving. That is called an angular acceleration, which is maintained by the semicircular canals. Whereas those utricle and saccule, they help in maintaining a linear movement, like when you move forward, sideways or up and down. So the brain receives signals from the right ear and the left ear. So what all we talk about now about these semicircular canals and the otolith organs, which are a part of vestibule, they are present in both the ears, right? So the brain receives the signals from the right ear and the left ear simultaneously. And whenever these signals match, we remain stable. And whenever they don't match, we feel an imbalance or a kind of giddiness that without the surroundings moving, you may tend tend to feel that you are falling forward or the things around or spinning around. This is what we call as vertigo. So it's not just the ears which help in balance here again. So you have to understand that the balance is mainly a coordination from three organs. So the brain receives the signals from the inner ear, eyes, and also from the body's position sense. So all these signals together reach the brain and they coordinate and then make you a standard position of balance which you will maintain to stand or sit whenever you are in any position. The brain should help you to maintain that position, receiving the signals from all these three structures like inner ear and what we see, eyes, and also the position of the body. And one more common thing that people experience, or whenever they go to a doctor with imbalance, they say that you have something called BPPV. That is a positional vertigo. So whenever you're getting up from the bed or whenever you are sitting and trying to lie down on the bed, you feel a position of completely the things around you are spinning around and you're falling about. So this is again maintained by the linear acceleration position, which is maintained by utricle and saccule. So here again what happens is the crystals inside the otolith organs are getting misplaced. So what is the treatment for this? What we need to do is repositioning the misplaced crystals. So an ENT surgeon, an ENT specialist will do the repositioning of the misplaced crystals. This is done by certain maneuvers. And also there are something called vestibular rehabilitation exercises which retrain the brain to adapt to the situation. So in these exercises, what they make you learn is that you are not really falling about, and this is just the movement of the head and the otolith organs, the sensory hair cells, everything should be in accordance. Like they will make you train that in these head positions you will be like this kind of. So head movements are done organizedly in these vestibular rehabilitation exercises, which makes you feel stable and better day by day. And so finally coming to the conclusion, the inner ear, it has mainly some balance organs which help you to maintain for both linear acceleration and also the angular acceleration. And these vertigo or imbalance, giddiness, it results whenever there is a mismatch from the signals receiving the brain. When there is a mismatch of the signals receiving from the ears, eyes, and the position, whenever these signals doesn't match, you feel a position of imbalance. So one last thing that I want to tell you is that whenever you feel an imbalance, never ever try to close your eyes. Whenever you close your eyes, you feel it even more. So whenever you're getting up from bed or sitting and trying to lie down, you feel a spinning sensation. What you should do, never ever with fear or getting scared, close your eyes. People tend to close their eyes, but never do that. Try to open your eyes, focus on one point, whatever is nearby. Just keep your eyes focused on one thing for exactly 30 seconds to 1 minute, and then you will surprisingly notice that the spinning comes down. So it is nothing, it's a magic. It's just the signals from the ears and the eyes you are helping the brain to match. So one last thing that I want to stress is whenever you feel an imbalance or a vertigo, never close your eyes. Try to focus your sight at one point. This is all for today. Thanking you, Dr. Lavanya.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.